Hey, my name's Spencer Wabel, and I just wanted to film an introductory video so that you could get to know me and what I do and have an idea of what a consultation looks like here at Sundance and see basically what we'll be going over when you get here. My job is to help people figure out what restoration they want and what it's going to cost, how they're going to finance it, what stages they're going to do it in, and just kind of walk people through what it looks like to get dental implants done. A dental implant typically is made up of 3 parts. If you're doing one tooth, usually you have a bolt here, and then there's a little connector piece called an abutment, and that connects it to a crown. I have one myself right here. It's a little discolored and it isn't finished yet. That tooth is one of these posts, and they don't really hurt to get. Any work you get done here at Sundance, you're numbed up, you're never gonna feel anything, but you do have the choice to be just completely numb or do some laughing gas or be completely sedated and asleep with our nurse anesthetist that has been doing 25 years of hospital-based anesthesia, and he comes in once or twice a month to make sure you're totally knocked out. He has his own separate cost, but he is available for patients that have issues with dental anxiety and want to go to sleep for any procedure. So we can do one tooth like that I have, for example, or we can do a bridges where it would be a section of teeth. Like if you had this back here, those 3 or 4 teeth, we could take those out and put in 2 implants and rest a row of teeth on 2 implants. In this case, you could rest like this block, right from here to here on these 2, and we do those all the time. The other thing that we help with, and the thing that I helped with the most on, is when people want to do a full mouth restoration. And I see people for one tooth, I see people for full mouths, but usually I'm more focused on the full mouth section. And that's when we're doing a full row of teeth, removing all teeth and putting in 1 row on the top, 1 row on the bottom, and you have implants supporting a full mouth restoration. Now, there's 3 different types of implant options that we offer, and the first one would be a clip-in, and that's where you would take this on and off. So this right here, these are the implants, and they have these little screw connectors to them. And this is down in your bone. It takes about 4 months to heal. And then after that, you have these little connectors here, and you basically put the denture down and click it on. Now that's one option. We will do a traditional denture, like a top plate where it's plastic, and match it up with a bottom denture if it's matching with a bottom arch. We won't do this solo, so we won't just take out your tops and put this in. We will only do one on an upper denture if we're matching it to the bottom. That gives us control over the bite, and that gives us a lot more flexibility with the overall restoration, so we're not messing with different parts, like having an off jaw on the bottom or some upper teeth. We can match the bite no matter if we're doing 1 or 2 arches, but usually what I see people do is a full arch, one or the other. Now sometimes because of cost, people will do one instead of the other, and that's where we're putting a full row of teeth on a few implants. Now the minimum we do is typically 4. It depends on your bone, and then we'll put on this block, which is held in with these screws here. To clean this, you just brush with normal toothpaste, and you're going to use a water pick to blow out this little seam here. And when you come and get this done, usually you come see me. We figure out financing, we figure out how long the treatment's going to take, all that stuff. Then you come in again and get your mouth scanned. After you get the mouth scanned, you will come in and get the surgery done. So this is where we would remove the teeth and place the implants, and then typically within the next day or a few days, depending on your case, we will put on this block of teeth. Now the block of teeth, we print it out and we hand paint these. We have a prosthodontist named Dr. Clemens that comes in and does them right now. It really depends on the case whether Dr. Nicholson or Dr. Clemens will work on them, but we paint the gums, we make sure the teeth look like you. We can reference pictures from the past and do things like that. It just depends on what you're after ultimately. But we do this block, whether it's the top like that or it's the bottom, and we're doing a full set. That's usually what I help people with. Now multiple implants, sometimes people come in, I say, I need the whole mouth done. We find out you only need 1 or 2 teeth. Sometimes people come in thinking they need 1 or 2 teeth and find out we need to do it all. The main thing that people come in with actually is once you lose 1 tooth, your mouth starts to get off kilter, and it causes pain, it causes issues. And this is a little representation of what we see with bone loss. So here you can see there's multiple stages of bone loss. A normal mouth is going to look like this, where you got some little dimples right here, and you have a full row of teeth. Now, after a certain amount of time, you might lose one of these teeth. Once you lose it, you start a progression. And eventually, if you don't maintain it, or if you don't work on it, what can happen is your bone can get down to this. And when we're trying to put these types of screws in the bone, if the screw is too long or too thick to go into the bone, there's some cases we have to build the bone back up and make sure that we can get it in there. But as you can see here, as soon as teeth are missing, the bone starts to resorb quite a bit. These are the different stages down here. But once 1 or 2 of these teeth are gone, your bone will just start to resorb and go away. And it looks like, I saw a patient come in that came in 7 years ago, got a scan, didn't want to do anything, came in again, and his bone, it looked like it had just gone away by half. And it was because he was missing those teeth, didn't want to do implants at the time, and now he's got really thin bone. It's really hurting him to eat, talk, and just function normally. So now he's got these issues where he has to get special types of implants done down there, and we're still able to do it, but it makes it more complicated. So when you're dealing with bone loss, where if you're missing a couple teeth or you've missed them for a while, your options start to get limited and really specific if you don't get something done quick. But this is just to show the general progression of bone loss and how your jaw goes away over time if you don't take care of it. Between these options, there's this one. This is kind of the middle option. This is zirconia, and this is the snap-in. All of them vary in cost a little bit, by a few $1,000s actually. And what people typically do is they'll go with the one that's best for them financially and health-wise. Some people will start out with the clip-on one because it's cheaper, and then in a few years they'll move to this one, and then a few years later move to this one. Some people, if their credit's at a certain level and they can afford the payments, go straight to this one. And the difference here is between all 3 of these, we're not going to put in goofy looking teeth. You don't have anything that looks weird when we put it in. As far as the aesthetics of it, we can make all of them look like a really good set of teeth. However, how they feel are very different. So when you have these sets of teeth in, this one feels the closest to natural teeth. That's zirconia. PMMA, or synthetic polymer, it's stronger than a denture, but it's not quite, it doesn't quite function the same way. It's easier to break than a zirconia one, and the snap-in denture would be the weakest one and takes the most upkeep because you really can't chew anything too hard on it without causing some damage. They're all great options, but each one of them has their advantages and disadvantages. The best one is this one. It's also the most expensive. This middle option is good, but with these 2, you're looking at a few years before they'll break or cause some stress fractures, and you'll just have to reprint them. The good news is once this is in, you're really good to go as far as keeping your teeth in, keeping the bone there. It doesn't do the bone loss thing where it resorbs into your face anymore. So there's a lot of good options, but sometimes it just takes some getting used to. And you can start out with this one, move to this one, then this one, go straight to this one, start here. Some people mix and match where they're like, look, I'll do this up top and the snap-in on bottom. So there's basically 3 that can interchange, where it's like, I'll have this one on top, this one on bottom, shoot like that. And it gives patients a lot of options as far as what they want to do financially, what they want to do for their health, and which teeth are going to work best for them. I'm free pretty much any day to talk, and I meet right here with you in this room, and then Dr. Nicholson typically comes in and talks to you about your options. We go through x-rays, we go through the consultation, we do all that for free. And then once we've completed that step, we give you basically a quote that says, hey, it's going to be X amount to do this, insurance will cover this. When do you want to do it? Do you want me to fall back in a week, a month, a year? There's some people I work with for 6 to 9 months before they get this done. And some people, we see them on a Thursday, and in 2 weeks they've got their new teeth in. So it really just depends on your time frame and what you want to get done on your mouth and what your abilities are. But we are able to do these things in about 2 to 3 weeks because Dr. Nicholson's brought on people like me who can do consultations sometimes the same day or within the same week usually, and a lot of staff members that he's brought on to make sure that we can do the operations, the surgeries, and those types of things really fast. There are some offices, I had a lady come in not too long ago that told me they can't do it unless they do probably 4 or 5 goo bites where they're like biting into a molding material to make sure that everything looks good and it's ready for it. With our digital technology, sometimes I can see you. We do the records appointment the next day or the next week and then have you in for surgery that same week. We have some people that come in and say, hey, I'm coming here because the other guys can't get me in for 9 months, and it takes a long time to do these cases. But because Dr. Nicholson's invested in his staff, in training, in the lab, in the surgical rooms, we have a lot of flexibility to do these cases. So when you have questions for me, I'm a real person. I'm not just some company system that you're getting plugged into. It's me, and I'm talking with Dr. Nicholson every day, and he's popping in here and seeing what's going on. The only reason he's not reaching out to you directly is because he's doing surgeries all day. So there's a lot of time-limiting factors on his end, but you can meet with me, you can meet with him pretty much any day. He makes time to do it so that we can move these cases as fast as possible. If you have any questions for me, I'm happy to go through it and help you understand what the steps are, but most of the time we're open any day of the week, and you can call me on my cell and I can answer any questions you have. Thanks for letting me give you a little explanation here, and I hope we see you soon. Thanks. Bye.